Did you know that over 100 million women worldwide rely on birth control pills as their primary method of contraception? Birth control pills are one of the most popular ways to prevent pregnancy. But there's much more to know about how they work, their benefits, and what to keep in mind when using them. In this video, we'll walk you through the different types of birth control pills, how they work, their effectiveness, potential side effects, and some common myths that need to be cleared up. So, what exactly are birth control pills? At their core, they are hormonal contraceptives that prevent pregnancy by altering the natural cycle of hormones in the body. There are two main types: combined oral contraceptives, which contain estrogen and progestin-only pills, sometimes called the mini pill. Both types work by preventing ovulation, thickening cervical mucus to block sperm, and thinning the uterine lining to prevent a fertilized egg from implanting. Combined pills are typically taken for 21 days followed by a 7-day break, during which most women experience a withdrawal bleed. This isn't a true period, it's simply the result of hormone withdrawal. Progestin-only pills are taken every day without a break, making them a good option for those who cannot use estrogen or have certain health conditions like high blood pressure or smoking. Now let's talk about effectiveness. When taken correctly, birth control pills are 99% effective at preventing pregnancy. However, the key phrase here is correctly. That means taking the pill at the same time every day without missing a dose. Missing even one pill can increase the risk of pregnancy. For this reason, setting a daily reminder or using an app can help ensure that you don't forget. One of the biggest benefits of birth control pills is that they are highly effective in regulating menstrual cycles. Many women experience lighter periods, fewer cramps, and more predictable cycles while on the pill. In fact, for some women, birth control pills can help with conditions like polycystic ovary syndrome, endometriosis, and acne, as the hormones can reduce the growth of facial hair and improve skin health. But like any medication, birth control pills come with potential side effects. The most common ones are nausea, headaches, mood changes, and breast tenderness, most of which tend to subside after a few months. Some women may also experience weight changes, breakthrough bleeding, or a decrease in libido. If these side effects persist or become bothersome, it's important to talk to a healthcare provider, as switching to a different brand or method may help. One of the more serious risks, though rare, is blood clots, particularly for those who smoke or have a history of cardiovascular problems. This is why birth control pills are generally not recommended for women over 35 who smoke. Women with a history of blood clots or other contraindications are usually advised to use other methods of contraception. Now let's debunk some common myths about birth control pills. One myth is that taking birth control pills will make you infertile. This is absolutely not true. Once you stop taking the pill, your fertility typically returns within a few weeks to months. Another misconception is that birth control pills protect against sexually transmitted infections. They don't. Condoms are still necessary to protect against infections like HIV, chlamydia, and gonorrhea. Many people also think that birth control pills cause weight gain, but studies show that there's no consistent evidence linking birth control pills with significant weight changes. If weight changes do occur, it's more likely to be due to hormonal fluctuations in the body or other lifestyle factors, not the pill itself. When it comes to preventing pregnancy, it's important to note that birth control pills are not the only option. There are plenty of alternatives like IUDs, implants, condoms, and sterilization, each with its own set of benefits and risks. The choice of birth control should be a personal one, and it's best to discuss options with a healthcare provider to find what works best for your lifestyle, health conditions, and family planning goals. So here's a question for you. What's your experience with birth control pills? Have you tried other methods? And what's been your go-to choice for contraception? Let us know in the comments. Use the comment section to ask, comment, and request whatever you want. Thank you for watching. See you in the next video. Stay informed, stay healthy.